It's just age? The truth about the hip joint. If your hip joint hurts and you've been told, well, what do you expect? It's age. This message is for you. By the way, write in the comments if you've heard that phrase before. In most cases, the hip joint does not deteriorate simply because of getting older. Today, I'll explain the real reason and what you can do to prevent further damage. At the end, I'll also share practical recommendations you can use at home. Why is it so important to pay attention specifically to the hip joint?
What happens if you ignore it? What will happen if you don't work on it and don't give it enough attention? At first, pain appears after physical activity, when standing up, walking, or going downstairs. Later, the lower back and knees start to hurt as well. The load redistributes to the lower back and knees, and these areas begin to suffer too. Osteoarthritis progresses faster, and the person moves less and less. Then again they hear, age, pills, injections, just tolerate it. Eventually, it may lead to hip replacement. And the most frustrating part is, why the damage can be stopped. In many cases, this could have been avoided, because the hip joint does not break down simply due to age. Today, we'll look at the real cause and what must be done to preserve the joint. Let's understand where the problem actually begins. The primary issue lies in our lifestyle. We often sit for long periods or stand for too long, which overloads certain muscles. The main cause, lifestyle. First of all, the muscle that connects the lower back and the hip joint becomes overloaded. It is responsible for bending the torso forward. The more time we spend in that position, the greater the strain on this muscle. Many people also go to the gym after work and start aggressively training their abs. The danger of improper ab training. Instead of strengthening the abdominal muscles properly, they continue overloading that same muscle. Over time, it suffers even more, and this often becomes the primary source of hip and lower back pain. This muscle is called the iliopsoas. Many people don't even know it exists, although it creates significant problems for both the hip joint and the lower back. How a shortened muscle changes your step. Because it works constantly, it gradually shortens. This shortening limits your stride since it initiates the forward movement of the leg. Your step becomes shorter, the load shifts, and the lower back starts taking on more stress. When the leg needs to extend backward to push off, a shortened iliopsoas prevents proper hip extension. Why lower back pain begins. As a result, the lower back becomes overextended. The lumbar curve increases, and the load grows. Even if the extra load seems small, over time it accumulates and leads to increasing back pain. Very often, the lower back starts hurting before the hip joint does. MRI shows a hernia, but the cause is elsewhere. A person goes to the doctor and gets an MRI. The report says, lumbar disc herniation. Treatment begins for the spine. But frequently, the problem lies not in the spine, but in the muscles around the hip joint. There is also a second reason the joint deteriorates: poor nutrition of the tissues. The second cause, impaired joint nourishment. The muscles around the hip joint can tighten and compress it like a vise. The joint surfaces come closer together, small blood vessels become compressed, and blood flow decreases. Because of this, osteoarthritis progresses more rapidly. Chondroprotective supplements are often prescribed to nourish the cartilage. Why supplements don't work? However, if the joint's transport system is impaired and blood flow is poor, it simply won't receive enough nutrients, no matter how many supplements you take. Why does one joint often suffer more than the other? Because the muscles around the healthier joint are less tense. Blood circulation there is better. But in a compressed joint, with or without supplements, nutrition remains insufficient. Sometimes doctors increase the dosage. Effectiveness may rise slightly, but the liver load also increases. We end up treating one thing while harming another. The correct recovery approach. The right way to stop hip joint deterioration is to relax the muscles surrounding it. Restore them to their natural anatomical length. Improve trophic support and blood circulation so the joint receives the nutrients it truly needs. Now, as promised, I'll describe exercises you can do at home to work on the muscles around the hip joint. And while you're here, check if you're subscribed and leave a comment. That helps more people see this information.
Our goal is to release the muscle vise around the hip, primarily the iliopsoas and the gluteal muscles.
Working on the iliopsoas. You'll need a tennis ball or a myofascial release ball. Lie down on a bed or couch. On the side you want to work on, let that leg hang down. Bend the other leg and place the foot on the surface. Find the most prominent hip bone, the iliac crest. With the ball, gently sink into the tissues near it and press the muscles inward toward the bone. Look for the most sensitive points. When you find a tender spot, hold pressure there for a short period. Work both sides symmetrically.
Working on the gluteal muscles. It's better to do this on the floor or a mat. Lie on your back and place the tennis ball under one glute. Move slightly toward the pelvic bones and press down with your body weight. Search for tender areas. If you find a point that sends discomfort down the leg, stay on it briefly. You can slightly change the leg position to intensify the sensation. After releasing the muscles with the ball, begin stretching.
Glute bridge. Lie on your back. Lift your pelvis slightly and gently tuck it toward yourself. You should feel a stretch in the groin and along the front of the thigh. Hold briefly. This stretches the iliopsoas and activates the glutes.
Glute stretch. Place one leg over the other so the ankle rests on the opposite thigh. Pull the leg toward you until you feel a stretch in the glute. Repeat on both sides. Deep iliopsoas stretch. Step into a lunge position, one leg forward, one leg back. Gently move the pelvis forward while tucking it slightly without arching the lower back. Raise the arm on the same side as the back leg and lean your torso slightly to the opposite side. This combines 3 movements: a slight forward shift, pelvic tuck, and side bend. You should feel stretching in the groin, abdomen, and front of the thigh. Repeat on the other side.